In this video, we're going to be reviewing the oral treatments for Peyronie's. We'll be going through some studies. We'll be reviewing whether they're effective, in what phase of Peyronie's they're effective, why or why not are they effective, and which ones work best and why. It's going to be a very interesting video, so let's get started. Alright, so let's get right into it. I actually made a bit of a presentation to help me with this video. This video actually took me quite a while to put together, so whenever you see like a large gaps in my videos, it's most likely because I'm working on some fire content, like something that's really taking me a long time to research, put together, you know, whether it's I'm reviewing a device that I'm really putting time into it. Like I don't like to you know, when I'm putting my mind into it, like I don't want to put out other content until I'm finished with it. And then in between those videos, I do put out like some filler content, stuff that's a little bit easier to do. So yeah, so anyway, so I've been working on this for a little while. So you can tell I'm pretty tired. It's been a long day. So I'm doing this for you guys, for a lot of the guys that you know, that are struggling with Peyronie's, that don't know what to do, freaking out. I've been there, you know. And I'm one of those people that I was actually able to surpass this thing and get better, and actually get way better, you know, in which my my member is actually a lot bigger, and I'm able to have amazing sex nowadays. And you know, I want to sort of put all the information out there, all the things that I did, and encourage you to basically treat it in a medically sound ways, you know, because it's just something that a lot of doctors don't even really understand. A lot of guys just don't even know sort of where to start. And you know, I want to put together just a framework to sort of help out all those guys. So you know, if you like this video, make sure you hit that like button, that subscribe button, and you know, leave a comment saying me that you like the video. You know, upvote it on the Reddit, just to help support me. You know, leave a comment on the Reddit, and you know, just let's help you know, grow the channel so that more guys are aware that there is a way to treat this. There is a way to get better and to get over it. And you know, a lot of the things could actually, like, you know, it's sort of like, what is that saying? I forgot what the saying is, but essentially, like, you know, that they can get injured even doing like PE exercises like jogging or some manual stretches. Like I've seen this over and over again, where they basically end up injuring themselves, ripping their tunica. Now they develop the Peyronie's. The irony is PE can actually be the treatment for these injuries. So it's kind of counterintuitive, because a lot of guys end up being scared. It's like, oh, I injured it doing PE, I'm never gonna do that again, right? Well, that's really the only way that you can treat it, right? It's the best way to treat it. So in any case, that's kind of why this what this you know, what this channel is all about. So with that being said, let's go ahead and get started. First, let's go a little bit over. So this video is going to be basically about Peyronie's and the oral treatments of Peyronie's. So first, let's do a little bit overview as to what is Peyronie. So Peyronie's is basically scarring or fibrotic tissue in the penis. This can be in the tunica, in the septum, or even in the corporal chambers. And this basically can cause curvature, can cause hourglassing. Hourglassing, essentially, think of a bottle and you squeeze the sides of the bottle. That's what's called like hourglassing. Can also cause shortening of the penis, and these things can be mentally devastating, right? Like this is not just a disease that affects you just physically, but it's mentally. I mean, I guess like most diseases, but it's very, very devastating to a guy seeing like their dick, you know, wasting away. Especially, you know, you regardless of the size, whether you have a huge dick or you had a small one, like this can be devastating for anyone. It happens to 3 to 9% of the male population. So it's not entirely uncommon. It's actually fairly common, and there's a lot of people that out there that this has happened to them. You know, I've heard of, you know, maybe I'll make the videos about this, but like, you know, UFC fighters, porn stars. You know, my doctor said that this is very prevalent in the gay community. I think it makes sense, because to me it happened where I was having very rough anal sex with my partner. And you know, it's basically I was predisposed to it, and so, which is basically what the cause of it is. Like according to you know, doctors and researchers, they believe that the main cause is basically trauma, repeated trauma or micro trauma, plus a genetic predisposition to this disease. So so a lot of the cases you see that a lot of the people, guys that get this, it's been either like their father got it, or they have something called like Dupuytren's contracture. Basically that's like a disease where the hand basically kind of gets stuck, where they can't really open it up, and it's very, very difficult to open it up. And it's exactly the same thing. It's basically they develop scar tissue in these parts of the hands where it makes it really hard for them to open it. And essentially it's because they're predisposed to the irregular formation of collagen, because their body produces a lot of what's called TGF-beta1. It's basically a growth factor, and this growth factor is basically makes the body put down extra and irregular collagen that's non-elastic, right? And so specifically type 1 and type 3, which is what's found in the Dupuytren's contraction and in Peyronie's. And sort of a side note, this is why I'm not a fan of BPC 157. I'll have a whole video on it, but essentially BPC 157 basically induces TGF-beta1, induces collagen formation. And while it's promoted as a healing, right, it's not something that I would ever take or I would ever recommend in the context of PE, because essentially you're mimicking Peyronie's, right? And you're mimicking that collagen formation in a regular state. Imagine if you already have Peyronie and someone tells you, oh, just inject some BPC 157, you're adding even more TGF-beta1 when you actually want to suppress TGF-beta1 such that you're adding more elasticity, more elastic tissue to the body. And I'll have like different videos on specifically on BPC 157 why I do not recommend it, and I do not agree that this is something that you should take. In any case, you know, so the guys are basically genetically predisposed for their bodies to create TGF-beta1, which in turn causes this irregular collagen formation. Peyronie's can also cause erectile dysfunction. We see this in a large number of cases. This actually was my case. I still take daily Cialis, but I was able to rehab my penis through a lot of the things that I discussed on the channel, you know, such as a vacuum rectum device, daily Cialis, injection therapy with a PGE1. In any case, the way that you diagnose it is if you have pain or a sudden curvature, a curvature that you did not have you know, when you were a kid, when you were basically, you know, a teenager going through puberty. If it's something, a brand new curvature, right? Because sometimes it can be difficult to tell the difference between a Peyronie's curvature and a congenital curvature, but that's basically the difference. Is basically if it's a brand new thing. Sometimes even congenital curvatures can be quite troublesome and can give you problems, but this specifically we're talking about Peyronie's, which is scar tissue that's caused by trauma and TGF-beta1. So basically, yeah, you get pain, curvature. You also get a palpable plaque sometimes. So keep this in mind. So when I was diagnosed, it was purely because of the pain and the sudden curvature. There was no palpable plaque, because think about when you get a cut, like see, I actually have a cut here. Actually, my freaking kid threw something at me, which is hilarious, and I didn't dodge it, and got me a little cut here. In any case, when you have like a cut, your body forms that scar tissue, right? And if it's a larger cut, you're not gonna feel that scar tissue for a little while, right? And this is not something that just appears right away. And maybe not even in a lot of cases, like it can be difficult to be able to tell whether you have a palpable plaque. You can also get an ultrasound, but this is not really necessary. Like if you already know that you have pain and there was a certain curvature. Plus, like I mentioned, scar tissue takes a while to form, so an ultrasound will not be very helpful at the very, very beginning. Later on, it can be very helpful to sort of see sort of the status of the scar tissue, whether it's been calcified. So basically what happens is after some time, the scar tissue can get calcified. And sort of side note, maybe you want to limit your milk, your vitamin, your milk intake, and sort of to stop calcification. But really, your body's gonna take calcium. Even if you deprive your body from calcium during this phase, your body's gonna take it from your bones, and you're gonna get calcification. So, but there's other ways. There's actually like some of the medications that you can use to basically stop this process, or at least inhibit it as much as possible. And that's what you want to do. Is you definitely do not want to get calcification, because that's like the worst thing, the most difficult thing to treat. It's essentially bone. It's like literal bone in your penis, and it's something that's extremely difficult to fix. Most likely you can only be really fixed with surgery. but it's something I'll talk a little bit more a little bit later on. You can also get, in order to get this diagnosis, you can a doctor can inject you with PGE1, and basically this is going to form induce an erection, and from here they can basically tell the degree of curvature, and you know, maybe you basically spot like find the plaque a little bit easier. But it really is just to see the curvature. So there's also two phases. There's the acute and the chronic phase. The acute phase can last anywhere from like a month to 6 months. Really, sometimes even longer, but not very often. In most cases, it's 1 to 3 months tops. And the acute phase is essentially when there's still pain. There's some degree of pain, but there's also changes in the penis. This is why it's extremely important that if you suspect that you have any sort of, that you injured your penis, or you may be developing Peyronie's or whatever, make sure you take measurements of your penis. So make sure you take a measurement of your bone press stretch flaccid length, your bone press erect length, and your erect girth. And in the case of curvature, like if you're seeing some sort of curvature, get a protractor and see and track the degree changes, and do this like every day. Essentially track any sort of changes that you're getting, right? And that way you know how to treat it. Because after the acute phase, you basically will move on to the chronic phase. So let's say that you know, in some cases, and I believe it's about 12%, the Peyronie's can actually spontaneously resolve. And the reasoning for this is twofold. One is basically their body is really not producing this TGF beta, and so your body is able to produce like more regular collagen, more elastic collagen, and basically it's gonna basically spontaneously resolve. Another reason could be like you're still getting strong erections, such that basically it's overcoming the contraction forces of the scar tissue, like because you're still getting a good erection. So I get a lot of messages from guys saying like, hey, I'm only having curvature, I'm only getting hourglassing in a semi-erect state, or you know, sort of in a chubby, but when I get a full erection, it goes away. Should I do anything? I'm like, well, if it bothers you, yeah, but if it doesn't, like, leave it alone, especially if you're in the chronic phase. And so basically the way that the reason that this happens is because your smooth muscle in your penis is able to overcome the contraction forces of that scar tissue. So imagine something's kind of like you're squeezing it, but your smooth muscle is so strong that it's basically overcoming that when you get a full erection, right? So if you're not, like, if this has been like this for a long time, I would say just leave it alone, like, especially if it doesn't really bother you, right? But basically what happens is after the first few months, you move into the chronic phase, and the chronic phase basically means that there's no more pain. Your body has already healed, whether in a contracted or, you know, a more regular flexible state. And there's really no rush to do a whole lot at that point, you know, except like you probably don't want to calcify it, right? Like, this says nothing about calcification, because calcification can happen even years afterwards. So I would still advise to do something if, you know, if it's like, if there was changes and you want to potentially do something about it. You just don't want to rush into any sort of surgery at that point. Really, I wouldn't rush into surgery at any point until you've sort of done all the sort of traction in the world that you could, and you know, and it's just not working for you. And when I mean like traction, like actually do traction, actually use it, and, you know, put like a good amount of tension, put in the hours, use it every fucking day. Like, a lot of the guys say like, oh yeah, traction just didn't work for me. I'm like, just because they didn't put in the time or the effort, right? So how do you treat Peyronie? So there's the absolute two best ways to treat it are with traction and a vacuum erection device. These are the absolute gold standard. This is the first thing that you need to do if you suspect you have Peyronie's. In the hyperacute state, just extremely light traction, right? Like, order the device, you know, and basically you just want to heal in an expanded state, you know, even if it's causing a little bit of you know, not too much pain, but essentially, like, imagine you get a cut, right? And you get a cut here in the joint, here in this part right here, right? It's going to hurt when you start expanding it, right? But guess what's going to happen? then the new scar tissue is going to start forming in an expanded state, and that's what you want. So even if you're disrupting that initial scar tissue, that's good. So don't don't be scared just because like you feel a little discomfort, like supposed to feel discomfort. Just obviously don't overdo it where you're causing more, you're cutting more of the original cut. What you want to do is disrupt the scar tissue. So it's a fine process. Do extremely light traction at the very hyperacute stages. After about 3 to 4 weeks, when your body has actually started depositing the scar tissue, then you can actually start, ramping up both in tension and time. And using a vacuum erection device. I don't really want to focus on that in this video. In this video, I'm going to talk about the oral medications and the supplements, and that's what I'm going to focus on. There's also topicals. There's a few studies on it. I may do a video on this. I already talked about DMSO. Well, there's no studies on DMSO. There are studies on other things. I prefer DMSO just because it's what I had access to. No doctor really mentioned any sort of topical thing, at least here in the US. There's also one thing that I forgot to put here, which is shockwave therapy. Now, I absolutely do not recommend shockwave therapy for Peyronie sufferers because a lot of the doctors that I've talked to, and from a lot of the, what I've read from, their experience online, is that shockwave therapy can actually re-trigger Peyronie. So let's say that you're already in the chronic phase and it's kind of already been healing and you're kind of fine. You use shockwave therapy, it actually re-triggered it, right? And now you're back to square one. Now, it may be good, actually, I want to put a caveat here that I actually want to try shockwave therapy. I may get like a Phoenix and I'll review it if I do. But that's only because I do traction consistently for many hours, right? And I use a vacuum erection device every day. If you're not doing those things, I absolutely do not think you should do shockwave therapy, because what it is going to break up the scar tissue, right? And then what? Like, it's going to re-trigger. You're going to have TGF beta 1. So if you do shockwave, you should absolutely be taking the oral medications, the oral supplement. Absolutely, like I recommend DMSO, such that you're inhibiting TGF with Pentoxifylline, such as though you're inhibiting TGF beta 1, so that if you're breaking up that scar tissue, it's not going to be forming in a contracted state, and so you're just breaking up the scar tissue and then forming new collagen in an expanded state. So I have the different video on my thoughts on shockwave therapy, and like I mentioned, I do want to get the Phoenix. So I don't know, I'm still kind of like thinking about it. It's pretty pricey, I'm not gonna lie, so it's gonna be quite an investment, but I don't know, we'll see how it goes. There's also injections. I mentioned injections of Pentoxifylline before. There's another thing called Xiaflex, which is collagenous. Essentially breaks down collagen, as the name implies, and that can be very useful. And again, things that you should be doing with traction to actually make them effective. Like if you're not doing traction, these things are kind of useless. Essentially, you're just reopening it, and it potentially can cause issues. So the number one thing you need to do is traction and a vacuum erection device. But oral medication and supplements are super important. The last thing is surgery. I just do not recommend it unless it's like you've tried everything already. You already did a ton of traction. But let's say that you have a really bad ED, then you can potentially get like a penile implant, to restore your erection so that you can have sex. There's other things, but I'll have a different video on the different sort of surgeries that you can get for Peyronies. Not something that I would recommend, but it's sort of like the last resort after you tried traction, vacuum erection devices for a couple years, And I mean consistently, not just like kind of half-assed. And with that, let's go ahead and actually start talking about the oral medications and the supplements. So first, I want to mention some medications that are basically outdated that you should not be taking. I started with colchicine, which is one of those. I actually got prescribed with this by some old Russian urologist, one of the first ones that I was seeing. I never took it, and I'm glad I didn't take it. I preferred Pentoxifylline. In any case, it's used to treat gout. It basically inhibits collagen deposition, but there has been studies, and the studies basically prove that it's not effective. It also has high side effects of nausea and diarrhea. There's also tamoxifen, which is an estrogen receptor agonist. It basically modulates TGF beta 1 like Pentoxifylline, which I'll get into Pentoxifylline a little bit. I actually have a whole video on Pentoxifylline. But again, the studies prove that it's not effective. You also get like hot flashes, alopecia, hair loss, ED, stomach issues, like it's just something you don't want to use. Carnitine, it's like some enzyme inhibitor. It basically is a strong antioxidant, but again, the studies just proved that it wasn't effective, and there's much better, safer antioxidants that you can take. Omega-3 fatty acids is an anti-inflammatory. Again, studies proved that it just wasn't effective. There's better anti-inflammatories that you can take, safer, can cause stomach issue. A crazy one, which is procarbazine. I don't know how you say it. I've just read it. It's a chemotherapy drugs, and basically when old people were like that had cancer were taking this drug, they saw a regression in their Dupuytren's contraction. However, it seems that studies proved that it wasn't effective, and it's actually quite toxic to your liver, and quite toxic to your kidneys, and it can cause fatigue and just intestinal issues all around. These are things that they're way outdated. You should never take any of this. So with that being said, let's go into Potaba, also known as PABA, or potassium para-aminobenzoate. Now, I had a video in which I combined DMSO with PABA. I linked a couple studies here. I don't want to go forever on this video, so I'll kind of, just kind of go quickly. So essentially, the conclusion is basically is that it can be effective in the acute phase. However, you have to take very high dosages, essentially 12 grams a day or 4 grams 3 times a day. And there were some side effects to that. So basically gut issues, also hepatitis. You can have low blood sugar, and this is why I only really use it with DMSO, because the reason that you have to take such high doses is because it has trouble reaching the tunica, as is in the case of a lot of these different things. However, in the studies, it was proven to be marginally effective. In fact, let's look at the study. So this is a study that we're going to be dissecting in this video. And essentially, basically, there was a study in the Peyronie's with patients with non-calcified plaques. For 12 months, patients of Potaba had significant improvement in the penile plaque size, and of course, people that didn't do anything, they had worsening of their curvatures. So Potaba can actually aid in the stabilization of scar tissue. However, there's not a whole lot of data after that. This was one of the sort of the only studies, and basically, it's because of the side effect profile, as I mentioned. So this is why this can be problematic. Now, I never took this orally. I only took it via DMSO, mainly because it's much less much less of it goes systemic, right? It will a little bit go systemic, but I'm also using way less, and I'm bathing the actual tissue of it, as opposed to trying to rely on the vascularity of the penis to deliver the drug. I'm actually delivering it via DMSO. So this is but it does work. But it unfortunately has some side effects, and it has a high dosage. Let's go to the next one. So then there's also antioxidants. So antioxidants and anti-inflammatory essentially helps the body sort of get rid of come out of the acute phase as fast as possible, and basically because it's really the scar tissue, the inflammation that causes TGF-beta1, which causes the irregular collagen deposition. So let's start with CoQ10. So there's a study on CoQ10. Basically, there was a study for 24 weeks using 300 milligrams of CoQ10 with 186 patients, and essentially 13.6%. So only 13.6%. Like, it basically kind of helped halt it in everyone except at least in the group that was taking CoQ10, except for 13.6% of those patients, it didn't do anything. Whereas in the placebo group, 56.1%, basically their disease worsened. So it seems that it was marginally effective here. Not crazy effective, but it seems like in the early chronic Peyronie's, like it can lead to the reduction of plaque size and penile curvature. So it's actually, so you can just take 300 milligrams a day, effective in the acute to the early chronic, and there was actually no side effects noticed. So this is very, very safe. So I think this is something that you absolutely should take. And I'll talk about like my recommended regimen in a little bit. Vitamin E. There's a study on a few studies on vitamin E. Let's look at this one. So this is like the same study that we looked at before, which is a great sort of summary of everything. So essentially, vitamin E is a strong antioxidant. It basically helps your body not like produce better or more nitric oxide, which basically is a precursor to an erection. I'll go a little bit more into nitric oxide, but you basically want that to get good erections. And also better blood flow, which blood flow really is what allows proper wound healing in the penis. So it basically helps protect this nitric oxide and helps also. It's a strong antioxidant. There was a study in 1983 of a double-blind placebo-controlled trial in 40 Peyronie's patients. There was no significant improvement in plaque size or penile curvature. So another study in 2007 compared vitamin E to a combination with L-Arganine to placebo in 236 men in the early chronic Peyronie's. So basically, they divided this into group 1, which is just vitamin E 300 milligrams twice a day. Group 2, L-Arganine once a day. Group 3, 300 milligrams and L-Arganine. And group 4 had placebo. So there was basically no significant changes in the reduction of penile curvature, nor any decrease. So basically, it's not very effective, you know. So it's just not effective according to this. However, it's an antioxidant. Potentially it can have some beneficial effects. It's relatively safe. Can have some side effects if you go over the dosage. So a maximum of 300 milligrams 2 times a day or 600 milligrams once a day. It's generally safe, but in high doses can be actually quite problematic. So never ever go over the high dosages. However, just not really effective according to the studies. Next, we'll take a look L-Arganine, L-citrulline. So L-citrulline, it's essentially it's a supplement. It's a supplement that causes an increase in nitric oxide, which not only helps reduction of the fibrotic tissue due to cell death, basically because it promotes good blood flow. Additionally, it helps you get erections, and really what you want, especially in the acute phase, is good erections as much as possible, right? And this is why it's effective, because not only does it decrease fibrotic because of good fibrotic tissue, because of the good blood flow, but it creates an internal traction or expansion. Like I mentioned, when you're having good strong erections, you're think of the example of the cut in the hand, right? You're stretching it, that causes the scar tissue to basically form in an expanded state, and that's why it's effective. It treats erectile dysfunction. So this is good. And L-citrulline is actually more effective than L-Arganine. I've heard of also cases where you can actually take them both. But I think the most safest thing is you can just take L-citrulline. And yeah, like I mentioned, L-citrulline is more effective. Basically, L-citrulline raises the circulating L-Arganine and nitrous oxide concentration, and maybe more bioefficient when compared to arginine supplementation itself. So this is a may, but I recommend just L-citrulline, by itself, at least better than just L-Arganine by itself. You could potentially combine them, but L-citrulline personally for me works great. So yeah, so the dosages you can, based on the studies, you can take 3 to 6 grams a day. Side effects, it's actually generally safe. It can decrease blood pressure and increase heart rate, but it is generally safe. PDE5 inhibitors actually was one of the ones that have been actually proven to be effective, based on the studies, and especially in the acute phase. It's actually, again, because it creates this internal traction or expansion, because you're having strong erections while the body is creating the scar tissue, which makes the scar tissue form in an expanded state. It also has anti-fibrotic property, and it treats the erectile dysfunction that could have been caused by the ED. Now you should be taking Cialis instead of Viagra, because daily Cialis stays in the system longer, thus helping you achieve more erections throughout the day, as opposed to like one on-demand erection. The dosage for Cialis is like 2.5, 5, or up to 10 milligrams a day. I basically, according to my doctors, I take which they prescribe me, I take 10 milligrams a day, but that's because like that's just me. I build up I don't know if it's like a psychological tolerance or whatever. 10 milligrams works for you. Obviously, just start with the lowest, most effective dosage, from 2.5 to 5. For me, what I actually do is I take 10 milligrams every day, and then if I want to have sex without injecting, I can take 20 milligrams before sex. But again, like, just talk to your doctor. Your doctor should know best, and listen to them. But you can always just start with like 5 milligrams a day. This was great. That's what I actually took in the acute phases. So I may be actually overdosing personally on Cialis, so just kind of take that with a grain of salt. But that's what my doctors prescribe me. Side effects can include, these are side effects that I actually suffer from sometimes: headache, dizziness, flushing. My skin can be a little red, kind of annoying. Nosebleeds can be quite annoying sometimes, especially because I do like kickboxing, so like a little hit on the nose and I start bleeding, which is quite annoying. Low blood pressure. There's more. Make sure you talk to your doctor to make sure that it's safe for you. But it is actually quite effective, especially in the acute and early chronic phase Peyronie's. Pentoxifylline, I have a whole video on pentoxifylline. Make sure you check that out. Make sure you check out that video. It's quite effective in the acute phase, and I'm talking about orally. Well, actually, let me revise that. It's marginally effective, and that's because the oral route, a lot of these things, while they work great in theory, like pentoxifylline actually has been shown in vitro to inhibit scar formation, to inhibit TGF beta 1, because it has antifibrotic properties. In vivo, it's just not as effective. It's marginally effective, so I would still recommend it. And it's also because it's actually generally safe, so there's really no harm. And I'll get into my theories and what I've heard doctors say as to why some of these works sometimes but not others, and so why there's just mixed data about their efficacy. But pentoxifylline is marginally effective. It's generally safe. You can dose it with 400 milligrams 2 to 3 times a day, depending on how you react to it. I was taking it 400 milligrams 3 times a day, and that was fine. I started at 2 and didn't notice any issue. Went to 3, didn't notice the issue. Eat it after every meal, and like basically you're fine. I never experienced any of the side effects, but you could potentially get fatigue, dizziness, flushing, headache. What's great about pentoxifylline is that it makes your blood less viscous and expands your blood vessels a little bit, especially the small blood vessels that are in the penis, thus allowing all the medicine that you take orally and supplements to better reach the plaques. So it actually can increase the effects of the other medicine or supplements. What I used to do is basically I would take my pentoxifylline, and then I would do traction, but I would do my vacuum erection device, such that when I had I would kind of calculate it. I would take it so that there was more of it, when it was like maximally in the plasma of the blood. I would then do the vacuum erection device so that it would reach as much as it could to the scar tissue. So I kind of timed it right with the vacuum erection device. Sort of an honorable mention. I don't even know how you pronounce this. Serraptease in Nattokinase. So there's actually no studies on this. This is sort of something that's been becoming a little bit popular in recent years in the Peyronie sufferers, in the forums. Has good testimonials. People say that it works. I'm gonna have a whole separate video on my thoughts on it. I never took it, so I can't personally vouch for it, but it does seem to have to basically break down scar tissue, to do a lot of the things like pentoxifylline does. It might be good with DMSO. These things, you can actually, like, their molecular weight is not very high. It's kind of like up there, like right in the range, the maximum range to be effective with DMSO. Something you could try. I've never tried this. I wouldn't recommend it, but it sounds like something that it could potentially work. However, one of the things that really scares me off is there's been some cases of things going really badly with it. So here's some case reports. Basically, someone substituted warfarin with nattokinase And basically they basically got like chest pain, in a thrombose, yeah, on a mechanical valve. So basically this person had an aortic valve replacement, and this basically caused it to, they needed a valve replacement. That's a big deal. Internal bleeding leading to death. So an elderly woman took over-the-counter Nattokinase for fibrillation, and she was not taking any other anticoagulants, and she basically died, right? She bled, internal bleeding to death. Anaphylaxis. Yeah, like they basically got an anaphylaxis, so they were allergic to it. The worst one, like, people have heard of PE horror stories. This is one of those Peyronie's horror stories. Essentially, this man, and I remember when this happened. I was in the forums when this happened. It's basically a 47-year-old man attempted to inject himself into an intravascular injection of Serraptease and Nattokinase. And now I'm not quite sure if it was like, again, I'll go more into it in my other video about it. I gotta do more research into it. I'm not sure whether it was the way that he injected or because of the supplements themselves. But essentially it caused his arm to go necrotic because it couldn't get blood flow, and so they had to amputate his whole arm. There's pictures, there's a study, and the guy was in the forums. It's crazy. So I would personally, even like I would never touch it. I wouldn't touch this shit, honestly. Like, so even if it's like, you know, I gotta see, people inject themselves with all kinds of shit, like, testosterone and all kinds of shit. So I highly doubt that it was his like injection technique. Maybe he had air, I don't know, but it was something where like this thing got into his bloodstream, and because of that he had to get his arm amputated. So quite horrific. So I'll have a separate video about that. I don't want to dive too much into it. It's not something that I would recommend. Okay, so now let's go over some of my personal notes. So in general, there's just not a lot of data with the oral medications. As I mentioned in my Peyronie's, in my Pentoxifylline video, that one is like the most promising, and it still doesn't have good data at all, right? However, we can conclude based on some of the limited studies and data that it's at very least marginally effective in the acute phase to the early chronic phase. And the reason for this, as my opinion and the opinion of other doctors and experts, and why it works in some people and why it doesn't in others, is because parts of the tunica are poorly vascularized, and they essentially just get their blood supplies through, kind of like your backbones through a bit of like osmosis. I forget the exact term for it. But in a lot of the medication, a lot of the supplements have a very short half-life, so it just never ever reaches the tunica, at least the scar tissue, right? And so some guys may have the scar tissue in places where it's actually well vascularized, in such that it's effective for them, but in a lot of cases it isn't. That's why, I combine it with DMSO to try to really reach the scar tissue. But we're talking about oral here. And it's generally not effective at all in the chronic phase. So if your body is already deposited the scar tissue, this stuff is just not going to do a whole lot. In my opinion, it's just because the scar is just much more difficult to reach, much more difficult to really penetrate with the medication, and much more settled. Particularly if it's calcified, like it's very, very difficult. So that's kind of my own conclusion. So with that being said, this is my recommended regimen if you're in the acute to early chronic phase. This is what I took. This is what I would recommend. Number one, Pentoxifylline, 400 milligrams, 2 to 3 times a day. Vitamin E, 300 milligrams, 2 times a day. And remember, the Pentoxifylline with a meal every time, or at least a snack. CoQ10, 300 milligrams a day. Cialis, either 2.5, 5, or 10 milligrams a day before you go to bed. This is so that your body, when you're sleeping, you're not as anxious. So you're gonna be developing those nighttime erections, and that's really, really gonna help. And then 3 grams of L-citrulline a day in the very morning. So in the morning, before you eat, you take the 3 grams L-citrulline a day in the morning. And so with this, you basically are going to have continuous erections throughout the day as much as possible. With the Cialis, as it builds up, it's going to help. It's going to be it's going to combine very well with the L-citrulline, and you're essentially going to create that internal traction, and that's what's going to help sort of offset the contraction of the scar tissue. So this is my recommended regimen. And there we go, another value-packed video on Peyronie's. Took me quite a while to put this together. Like I did a whole lot more research on this than I did even when I started taking it. And I gave you, I think, a lot of insights, a lot of my experience, a lot of the things that I saw in the forums, a lot of my consultation with doctors, either via the forums or online, or when I saw them and I met with them. And so yeah, hopefully you enjoyed this video, you learned something from it. If you like it, make sure you hit that like and subscribe button. Stay tuned, because there's going to be a lot more videos coming up. I have a few reviews coming up. If you have any questions, you can hit me up on Reddit. That's the best way to reach me. Again, make sure you support me, whether it's on Reddit or just upvote and leave a comment, just to help support the content. Make sure you check out these other videos which may be relevant to you, and I'll see you next time. Peace.